Alzheimer's disease affects more than 5 million people here in the U.S., but there's a new study out that says we can delay Alzheimer's. Dr. Kevin Campbell here this morning with more. Doc, good to see you.
Good to see you, Phil.
Before we get to this new study, describe for our folks at home what exactly is Alzheimer's.
Alzheimer's is the most common type of dementia in the U.S. It's really associated with loss of memory, difficulty learning new tasks, and some behavioral issues. People begin to decline over time. It's very insidious. It doesn't happen quickly. And you can see symptoms as early as age 30, like you and I were talking before the segment.
Yeah, well, why don't you tell us what some of those symptoms might be?
Sometimes you may find that you have trouble remembering things, forgetfulness, and actually trouble learning and processing new tasks, because Alzheimer's really seems to affect those areas of the brain more than others.
How is it treated?
Right now, there is no cure for Alzheimer's. There are drugs out there that are FDA approved and have been effective in helping to diminish the symptoms. We can't seem to stop the progression or cure it. Scientists have found that in Alzheimer's, you have plaques that are deposited in certain areas of the brain with a particular protein called amyloid that's deposited there, but we still have not worked out exactly how to cure it.
Let's get to this new study. This came out, in the past couple of weeks, right?
There's an international Alzheimer's conference that was held in Copenhagen in the Netherlands in the last week, and they presented a new study that looked at ways to prevent the onset of Alzheimer's. And what they found is if you treat blood pressure and cholesterol, limit obesity, and then have regular exercise as well as cognitive training, brain games, to really engage your brain, that it seems to significantly delay the onset of Alzheimer's, which is important.
Brain games, crossword puzzles, things like that. Reading, I would imagine, also
Absolutely.
up there.
And interestingly, social interaction. A lot of older people become depressed and withdraw and don't interact with others. This study really argues that it's critical for social interaction in order to diminish the progression of Alzheimer's.
Important stuff. Dr. Kevin Campbell, always good to see
Thank
you,
you,
sir. And of course, if you have a medical question for Dr. Campbell, really easy. Log on to our website, WNCN.com. Search links we mentioned. From there, you can find Dr. Campbell's website, or you can like his Facebook page and hit him up on Twitter.